Is it normal for a man's penis to get smaller as he ages? This question might be uncomfortable to ask out loud, but it's something many men wonder about silently. Well, some degree of penile shrinkage is a natural part of the aging process. Just as hair thins and skin wrinkles, the genital area also experiences changes over time. These changes typically happen gradually, often going unnoticed until they become more pronounced. Understanding what's happening and why can help reduce anxiety and point towards solutions that might help maintain penile health and function for many years to come. Let's talk about what actually happens when the penis appears to shrink with age. First, it's important to understand that the penis itself has two main states, flaccid and erect. Changes can affect both states differently. In the flaccid state, many men notice the most obvious changes. The penis may appear shorter or less prominent than it once did. During erections, some men might notice less firmness or slightly reduced size compared to their younger years. Several biological factors contribute to these changes. Blood flow is perhaps the most significant factor. As men age, blood vessels throughout the body, including those supplying the penis, can develop plaque buildup. This condition, called atherosclerosis, restricts blood flow. Since erections depend entirely on blood-filling specialized chambers within the penis, reduced blood flow means less impressive erections and potentially a decrease in size. Testosterone levels also play a crucial role. This hormone peaks during early adulthood and gradually declines with age, typically about 1% per year after age 40. Lower testosterone can affect tissue health and elasticity in the penis, contributing to a less robust appearance even when flaccid. The development of scar tissue is another factor. Over decades of use, microscopic injuries can heal with tiny amounts of scar tissue, which is less elastic than healthy tissue. Over time, this accumulated scar tissue can limit expansion during erections. Weight gain significantly impacts how the penis appears. As the lower abdomen accumulates fat, it can partially bury the base of the penis, making it appear shorter without actually changing its true size. This effect, sometimes called buried penis, can make the penis seem to have shrunk by an inch or more, when in reality it's simply less visible. Finally, the suspensory ligament, which anchors the penis to the pubic bone, can lose some elasticity over time. This may cause the penis to hang at a different angle or not extend as far as it once did during erections. So how much shrinkage is actually normal? Research suggests that many men experience a decrease of about half an inch to 1 inch in length over time. This change doesn't happen overnight. It's a slow process that occurs over many years. The exact amount varies greatly from person to person based on health, habits, and genetics. Some men might notice very little change, while others experience more. It's worth noting that what a man sees when looking down at his own penis often seems smaller than it actually is due to the viewing angle. This optical effect, combined with age-related changes, can make the difference seem more dramatic than it truly is. Let's look at the main causes of penile shrinkage in more detail. Poor blood flow is the #1 cause. The penis relies completely on good blood circulation to achieve and maintain erections. As blood vessels narrow with age, less blood reaches the penis, resulting in less fullness during erections and more shrinkage when flaccid. This is why heart health and penis health are so closely linked. Hormone changes rank as the second most common cause. Testosterone helps maintain tissue health throughout the body, including the penis. When levels drop, tissues may become less firm and elastic. This affects both the appearance and function of the penis. Weight gain is the third major factor. For every 35 pounds of excess weight, up to 1 inch of penis length can be hidden beneath fat in the pubic area. This doesn't change the actual size of the penis, but it does reduce how much is visible and usable. Lack of use can also contribute to shrinkage. Regular erections help maintain penile health by bringing oxygen-rich blood to the tissues. Without regular erections, whether from sexual activity or normal nighttime erections, tissues can become less elastic over time. Have you ever heard the phrase, use it or lose it? This applies to penile tissue as well. Smoking and excessive alcohol use speed up age-related changes by damaging blood vessels and reducing blood flow. Smokers are more likely to experience erectile problems and penile shrinkage at earlier ages than non-smokers. Certain medical conditions like diabetes, high blood pressure, and high cholesterol can worsen shrinkage by affecting blood flow and nerve function. These conditions damage the tiny blood vessels in the penis first, before causing noticeable problems elsewhere in the body. Medications, particularly some used to treat high blood pressure, depression, and prostate problems, can also affect penis size temporarily by reducing blood flow or affecting hormone levels. The good news is that there are several effective ways to slow down or even reverse some penile shrinkage. The most important step is improving blood flow throughout the body, which directly benefits the penis. Regular exercise, especially activities that get the heart pumping for at least 30 minutes several times a week, can make a big difference. Walking, swimming, biking, or any activity that raises the heart rate helps keep blood vessels healthy and improves circulation to all parts of the body, including the penis. Strength training is also helpful because it boosts testosterone levels naturally. Even simple exercises like squats, push-ups, and light weightlifting 2 or 3 times weekly can help maintain hormone balance. Higher testosterone levels help preserve tissue health and sexual function. Diet plays a major role in maintaining penile health. Foods that are good for the heart are also good for the penis. This includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats, like those found in olive oil, nuts, and avocados. Some specific nutrients are especially important for sexual health, including zinc, found in oysters, meat, and pumpkin seeds, vitamin D from sunlight and fatty fish, and L-arginine in watermelon, nuts, and fish, which helps the body produce nitric oxide, a compound that relaxes blood vessels and improves blood flow. Losing excess weight, particularly around the abdomen, can make the penis appear longer simply by revealing more of its base. For some men, losing 35 to 40 pounds can reveal an additional inch of usable penis length that was hidden under fat. This change can happen relatively quickly compared to other methods. What are your thoughts on this? Comment below so we can explore topics that matter to you on the next videos. Quitting smoking provides almost immediate benefits to blood flow. Within just weeks of quitting, many men notice improved erection quality as blood vessels begin to recover from the damage caused by tobacco. After several months, this improvement can lead to fuller erections and less shrinkage when flaccid. Reducing alcohol consumption also helps maintain penile health. While moderate drinking, 1 drink per day, isn't likely to cause problems, heavy drinking damages blood vessels and nerves while also lowering testosterone levels. Cutting back can help preserve function and size. Specific exercises designed for the penis itself may help maintain elasticity and prevent further shrinkage. One simple technique involves gently stretching the flaccid penis outward for about 30 seconds, releasing and repeating several times. This can be done daily to help maintain tissue elasticity. Does this sound like something you might be willing to try as part of your daily routine? Regular sexual activity, whether with a partner or through self-stimulation, helps maintain penile health by increasing blood flow to the area. Aim for at least 1 erection every few days to keep tissues healthy and prevent atrophy. There are several common myths about penile shrinkage that cause unnecessary worry. Let's clear these up with facts. First, many men believe that shrinkage means something is seriously wrong with their health. While changes can sometimes signal health issues, some degree of change is simply part of normal aging. Just as hair grays and skin wrinkles, genital tissues also change with time. Another widespread myth is that once shrinkage occurs, nothing can be done about it. This simply isn't true. Many of the changes, especially those related to blood flow and weight gain, can be improved with the right approach. The penis has remarkable ability to regain function and appearance when blood flow improves. Some men worry that medications like those for blood pressure or cholesterol will permanently shrink the penis. While some medications can temporarily affect erections or size, these effects are rarely permanent and often improve when the medication is adjusted or changed. Always talk to a doctor about sexual side effects rather than stopping medication. Many also believe that age automatically means the end of a satisfying sex life. This myth ignores the fact that many men remain sexually active and satisfied well into their 70s, 80s, and beyond. Changes in size don't necessarily mean changes in pleasure or function. There's also a myth that penis pumps or stretching devices can permanently increase size beyond what was normal in youth. While these devices may help restore previous size by improving blood flow or stretching tissues, they typically don't create growth beyond what was natural before shrinkage began. Some men believe that testosterone replacement therapy is a quick fix for all penile issues. While hormone therapy can help in cases of significantly low testosterone, it's not right for everyone and comes with potential risks. It's also not a complete solution on its own without addressing other factors like circulation and overall health. Another common misconception is that penile shrinkage happens suddenly. In reality, the process is gradual, often occurring over many years. What seems like sudden shrinkage is usually just the point when a man first notices the cumulative changes that have been happening slowly. Some worry that shrinkage means cancer or another serious disease. While sudden or dramatic changes should always be checked by a doctor, gradual changes are rarely a sign of cancer. However, any unusual lumps, pain, or dramatic changes in appearance should prompt a medical visit. There's also a belief that penile exercises are dangerous or ineffective. When done correctly and gently, basic stretching exercises are safe for most men and may help maintain elasticity. The key is using gentle, consistent techniques rather than aggressive approaches that could cause injury. Finally, many men think they're alone in experiencing these changes. In reality, penile shrinkage affects most men to some degree as they age. Have you ever felt embarrassed to discuss these normal body changes with a healthcare provider? While some changes with age are normal, there are situations that call for medical attention. Any sudden or dramatic change in penis size, especially when accompanied by pain, should be checked by a doctor right away. This could signal an injury to the tissues or blood vessels that needs treatment. Persistent difficulty getting or maintaining erections is another reason to seek help. This could indicate blood flow problems that affect not just sexual function, but might signal heart disease or diabetes. The penis often shows the first signs of these conditions before other symptoms appear. Unusual curvature that develops or worsens over time might indicate Peyronie's disease, a condition where scar tissue forms inside the penis. This can cause painful erections, significant bending, and shortening of the penis. Early treatment can help prevent permanent changes. Any unusual lumps, sores, or changes in skin color on the penis should be examined promptly. While most are harmless, some could indicate infections or, rarely, cancer. Early detection makes treatment much more effective. Pain during erections or ejaculation is never normal and should be evaluated. This could indicate inflammation, infection, or other conditions that respond well to early treatment. If attempting to lose weight, increase exercise, or make other lifestyle changes doesn't improve symptoms after several months, it's time to consult a healthcare provider. They can check for underlying medical conditions or recommend specialized treatments. For men taking medications for high blood pressure, depression, or other conditions who notice changes in penis size or function, talking to a doctor about adjusting dosages or trying alternative medications might help. Never stop taking prescribed medications without medical guidance. The good news is that many effective treatments exist for age-related penile changes. These range from simple lifestyle modifications to medications that improve blood flow, hormone therapies when appropriate, and devices that can help maintain or restore function. Remember that maintaining overall health is the best strategy for penile health. Regular checkups, a heart-healthy diet, regular exercise, not smoking, limiting alcohol, and managing stress all contribute to better sexual health as men age. It's also important to maintain open communication with sexual partners. Many men worry unnecessarily about size changes that partners don't notice or don't find important. Honest conversations can reduce anxiety and focus attention on the many aspects of intimacy beyond physical dimensions. With the right approach, many men can maintain satisfying sexual function throughout life. Age brings changes, but with proper care, understanding, and sometimes medical help, these changes don't have to significantly impact quality of life or relationships. The key is addressing concerns openly with healthcare providers, rather than suffering in silence or trying unproven remedies that might cause harm. Thanks for watching. Let us know your thoughts in the comments. Your feedback helps us create better content. See you next time.